In this lecture, we are revising one of the causes of esophageal obstruction, the Plummer Vinson syndrome. So let's start with some high yield points. It is also known as Patterson-Brown-Kelly syndrome, occurs in middle-aged edentulous without teeth women, pre-malignant lesion. Approximately 10% of the patients develop squamous cell carcinoma of the esophagus, oral cavity, or the hypopharynx. Iron deficiency anemia is a common finding known as the sideropenic dysphagia. The cause of dysphagia is usually a cervical esophageal web, also known as the post-cricoid web, but abnormal pharyngeal and esophageal motility may play a role. It is characterized by dysphagia due to upper esophageal web, chronic iron deficiency anemia, atrophic oral mucosa, and glossitis. Glossitis is a smooth red tongue and brittle smooth-shaped fingernails, also known as koilonychia, splenomegaly, and achlorohydria. Investigations are CBC, peripheral smear. On peripheral smear, you will find hypochromic microcytic anemia and iron studies, serum iron, serum ferritin, barium swallow, video fluoroscopy, and upper GI endoscopy for demonstrating esophageal webs. As you can see in the picture, a person having a barium swallow. In the figure, the arrow indicates a obstruction created due to esophageal web, and it is in the region of post-cricoid region, upper esophagus. The treatment is gentle dilation, iron therapy, and vitamins. Gentle dilation for treating esophageal webs, and iron therapy and vitamins for treating anemia. Remember that esophageal web in the Plummer-Vinson syndrome is found at the upper end of the esophagus, and Schatzki's ring is found at the lower end of the esophagus. Schatzki's ring is a feature of Barrett esophagus and GERD. MCQ number 1. Patterson-Brown-Kelly syndrome is characterized by all except lower esophageal web, iron deficiency anemia, common in adult female, pre-malignant A and C. So the answer is A and C. E, option E. As in the Plummer-Vinson syndrome, the esophageal web is in the upper esophagus, and it is common in middle-aged females, not in adult female. So the answer is option E. MCQ number 2. Dysphagia in Plummer-Vinson syndrome is due to post-cricoid region commonly involved in web formation. Web is common in lower region. It is due to abnormal vessels. Web is common in middle zone. Decreased motility of esophagus. So the answer is A. The answer is A. For practicing more MCQs on this topic, visit the website link given in the description. Thank you.